Hi, my name is Dr. Sanmi Areola. I'm the director for the Johnson County Department of Health and Environment. It's a very interesting time. Assessment and response to outbreaks is really at the core of what public health is about. We do that routinely, albeit not at this scale. This scale is kind of a little bit different. And throughout my career in public health, I've dealt with multiple incidents from West Nile virus to Zika to several other public health outbreaks. We at Johnson County, we have taken steps that are timely, that are appropriate, and in my opinion, that are adequate. It's serious because we don't have a full picture of what's going on in the community, which is not unusual. Very seldomly do we have enough data that tells us everything. We often have to make decisions based on insufficient information, which is part of what we're doing. But these are steps that have been tried in other places where this has happened, at other times when similar outbreaks have happened. And if we get the appropriate level of cooperation, these should work against and stop in some way, reduce the spread of this virus. We are hopeful that we get more tests. I think it's important for people to know that there's a very strong indication that the virus is here and in the country. So you shouldn't and you don't have to wait for a test to take those steps. So if you have mild symptoms, we don't need you to wait for a test or go and clog up the system for people that absolutely need the test. That's why we are putting out guidelines for you to self-quarantine if you have mild symptoms. If you've been exposed to somebody with that's confirmed, there are guidelines that are out there, including self-isolation. We do need more testing to be able to get a good picture. One of the biggest concerns with the spread of the virus is quite a lot of people who are healthy, asymptomatic, meaning no symptoms at all, carry this virus and they are spreading that. So symptoms cannot be the basis for you to determine whether you follow the recommendations or rules that we are putting out there. It is very possible for you to carry the disease, the virus, and not show any symptoms. So we're asking you to follow the recommendations that we are putting there. That's the only way that we can curtail the spread and at least slow it down in some way. We don't have all that we need, but we have enough to do what we're doing now, and we're going to keep working to get more to make sure that our healthcare workers are protected, and that because that's also a big part of it. In other places, we've seen infection amongst healthcare workers. Those are critical infrastructure that we want to protect. Obviously, the longer this goes on, the more the challenge will be on those resources. But we are working with our healthcare organizations and tracking those things, and clearly working with the state and the federal agency to ensure that those supplies keep coming. The biggest way to prevent the spread of COVID-19 is to follow the rules. Okay? A lot of them are common sense rules. Wash your hands and wash them long enough to be able to dislodge whatever will be there. That's why we say for at least 20 seconds. And make sure you wash all of the corners there. Make sure you dislodge that, and don't do that in a hurry. Some people sing, some people count 1,000, 2,000 to 20. But the premise is the same. Hand wash is still the best way to dislodge things. When that's not available or in between hand wash, we ask that you use hand sanitizers. Those are very helpful. If you have to sneeze, we ask that you sneeze into a tissue paper or you sneeze into your arm like that. That will kind of reduce the opportunity for anything in your droplets to get into the air. We ask that you practice all that we've been saying about social distancing, which is research shows us that if you are within 6 feet of somebody for a period longer than 10 minutes, your risk goes up. So we're asking you to keep that distance, but also to reduce the time that you spend with people. But when you have to spend more than 10 minutes, keep a 6 foot distance. We ask that if you touch surfaces, because again, this will linger in the environment, we ask that, again, you go, if you touch it, before you touch your body, your face, your mouth, your eyes, go and wash your hands again. It's amazing how simple it looks, but it's amazing how effective it is if we just keep those basic hygiene of cleaning our hands, sneezing the right way, because we will do that once in a while, and just understanding the premises why social distancing is very important to controlling this virus.